Welcome to This Explainer. If you're dealing with severe, recurring head pain, you already know just how completely paralyzing it can be. So we're jumping right in today. We are going to map out the exact clinical journey to relief, from understanding the science of your triggers, to actively tracking them, to knowing exactly what happens when you finally step into a specialist's office. To make this whole journey super transparent, here's our roadmap. We're going to cover the migraine mystery, food and gut connections, gathering your evidence, prepping for the doctor, the neurology exam itself, and wrapping up with your custom plan. All right, Section 1, the migraine mystery. Let's look at what's really triggering your head pain. You know, when a migraine hits, it feels completely out of your control, right? It just strikes out of nowhere, bringing on light sensitivity and nausea that completely derail your entire day. But here's the thing. Your body might actually be reacting to hidden triggers that we can track down and identify. The medical consensus is that treating migraines effectively means we have to stop just gritting our teeth through the pain and actually put on our detective hats to investigate where it's coming from. Moving on to Section 2, food, gut, and headaches. We're looking at the surprising link between your stomach and your head. Okay, let's talk about the leaky gut. It sounds a bit intense, but if you have specific food intolerances, it can actually increase your intestinal permeability. Basically, this creates a situation where a massive pro-inflammatory immune reaction spreads throughout your whole body. And this systemic inflammation, it can be the exact mechanism pulling the trigger on those severe head pains. It's literally a chain reaction starting in your stomach and ending in your head. To put that into perspective, just look at this number. In a really remarkable study of 115 kids with chronic headaches, a whopping 87% became completely headache-free. 87%. And how did they do it? Simply by cutting out triggers like caffeine, aspartame, cheese, citrus, and nitrates for just 6 weeks. It's honestly mind-blowing how powerful dietary and lifestyle changes can be when it comes to dropping that attack frequency. Research also points to IgG food antibodies playing a big role here. Doing a customized elimination diet that targets your specific triggers is a real game changer for reducing how often you get migraines. But here's the best part. That frequency drops even further when you combine the diet with gut-healing probiotics. You're essentially shutting down that whole systemic immune response right at the source. Which brings us to Section 3, gathering your evidence. It's time to become the lead investigator of your own health. So, relying on just your memory during a doctor's visit? Yeah, that usually leads to missing a lot of subtle clues. I mean, when you're in pain, the days just blur together anyway. But logging a 4-week headache diary? That gives you hard, actionable, clinical data. Your neurologist absolutely needs this to figure out if your pain is episodic or chronic, to spot those sneaky personal triggers you might have missed, and to accurately measure if future treatments are actually working. And the good news is, you don't have to lug around a physical notebook. You can just use some really great digital apps, like Brain Twin or Dogboken. Use them to log everything. The duration and intensity of your attacks, sure, but also your daily food, your sleep patterns, hormonal shifts, and even the weather. This data becomes the absolute foundation for getting an accurate diagnosis. All right, Section 4, prepping for the doctor. Let's get you armed and ready for that crucial first consultation. To get the absolute most out of your appointment, you need to show up with this exact checklist. Bring your completed clinical questionnaire and, of course, that 4-week headache diary we just talked about. You also need to list every single medication you're currently taking, even over-the-counter painkillers, because medication overuse headache is a very real factor. Toss in your suspected lifestyle triggers and any previous MRI scans, so the specialist gets the full picture from minute 1. Now, I love this insider tip from neurology clinics. Bring a partner or relative into the room with you. It's a total game changer. When you're in the middle of a migraine, you are just surviving. But someone who knows you well, they'll often notice subtle behavioral shifts, frequency patterns, or aura symptoms that you might completely miss. They act as a vital secondary witness for your doctor. Moving to Section 5, the neurological exam process. Let's demystify what actually happens in the clinic. So, the investigation follows a super structured path. It kicks off with an in-depth 25 to 30-minute interview about your medical history, which is where all that evidence you gathered really shines. Then, you move into a clinical physical exam. Finally, if it's an atypical case or if your headache pattern has suddenly changed, the specialist might order an MRI. But honestly, most of the time, they can make a confident diagnosis based on your history alone. People often get a bit nervous about the physical exam itself, but it literally takes just 5 to 10 minutes and is completely painless. The neurologist is just safely checking your cranial nerves, motor skills, reflexes, and coordination. It's a quick but absolutely crucial step to map out what type of headache you have, verify your nervous system is working normally, and, most importantly, rule out any other dangerous causes of head pain. Finally, Section 6, your custom treatment plan. This is all about finding your personalized path to relief. When it comes to treatment, there is definitely no one-size-fits-all magic bullet. Depending on your specific diagnosis, whether it's episodic or chronic, your plan is going to be uniquely tailored to you. It might include acute medications to stop attacks right in their tracks, or daily preventative pills to lower the overall frequency. For chronic sufferers, it might even involve advanced targeted therapies like CGRP inhibitors. Plus, we'll be integrating those vital lifestyle changes we discussed, like specific diet modifications to fix gut inflammation or cognitive therapy for stress. Ultimately, reclaiming your quality of life isn't just about waiting around for a magic pill. It starts with you actively taking control of your own data. From tracking down hidden food intolerances to diligently logging your symptoms in an app, you hold the keys to your diagnosis. So what piece of evidence will you uncover today? Thanks for joining me for this explainer, and here's to solving your migraine mystery.